Welcome back. In this video we'll be talking about the intracranial hemorrhages, and we'll talk about the epidural hemorrhage, subdural, and subarachnoid hemorrhage. Here are the layers that covers the brain, from the meninges to the skull and the scalp. So if the bleeding occurs in this area, right between the skull and the dura, we call this epidural hemorrhage. The ruptured vessel will be the middle meningeal artery, which is a branch of the maxillary artery and courses between the sphenoid and the temporal bone. Right about here. The cause of epidural hematoma is lateral trauma to the head, and it classically presents with lucid interval. This means that the patient will lose consciousness right after the trauma, and he will regain consciousness and lose it again. The cause of lucid interval in epidural hematoma is that the first strike to the skull will cause shaking in the brain, and this will cause loss of consciousness. The brain will regain consciousness, but there will be an active bleeding in the epidural space, which will keep increasing in size and compressing the brain till he loses consciousness again. This is the imaging of the epidural hematoma. We see the classic biconvex or lentiform shaped hemorrhage right underneath the skull, and usually will be singular and it will not cross the suture lines. Suture lines are connections between the dura mater and the skull bone. Back to our previous sketch, if the bleeding occurs between the dura mater and the arachnoid mater, we call this subdural hemorrhage. The ruptured vessels are bridging veins, so it doesn't cause as severe of hemorrhage as the epidural hematoma, and the causes can be acute or chronic. Acute causes like trauma or abusive shaken babies will appear dense, and chronic causes like old traumas or atrophic brain or alcoholism will appear pale. Because there is no suture lines in the subdural space, and due to its large volume, the bleeding will continue as crescent shape. So the bleeding will cross the suture lines and will usually cause midline shift. If the bleeding occurs between the arachnoid layer and the pia layer, we call this subarachnoid hemorrhage. It's caused by aneurysm rupture or arteriovenous malformations rupture. The striking feature is the patient will say that this is the worst headache of my life. So if you see worst headache of my life in the presenting case, put subarachnoid hemorrhage as your first presenting diagnosis. In subarachnoid hemorrhage, the lumbar puncture will show xanthochromic spinal tap, which is the CSF stained with blood. A serious complication of subarachnoid hemorrhage is that a week later there will be an intense cerebral vasospasm. So following subarachnoid hemorrhage, the patient will have another infarction because of the cerebral vasospasm, unless we give them nimodipine. Which is a calcium channel blocker. Unlike subdural and epidural hemorrhage, subarachnoid hemorrhage will present with bleeding in the middle of the cranial cavity. So if you're suspecting subarachnoid hemorrhage, don't look at the sides but look in the middle. You should see diffuse densities along the brain parenchyma. And finally, if the bleed occurs within the brain parenchyma itself, it's called intraparenchymal hemorrhage. And it's due to rupture of any vessel that is within the brain parenchyma itself. And this has a variety of causes, from neoplasms to vasculitis to hypertension or whatever. But the most common cause is chronic hypertension causing Charcot-Bouchard aneurysm rupture. Like subarachnoid hemorrhage, look in the middle of the brain, not on the sides, and you should see a singular hyperdensity inside the brain parenchyma. To differentiate between the intraparenchymal hemorrhage and the subarachnoid hemorrhage, try to look in the presenting case history. Alright guys, that's everything I've got. I tried to explain this as best as I could. Hopefully I made this easier for you, and see you guys later.